Good evening, everyone, and welcome. I would like to call the meeting of the Finance and Human Resources Committee to order. I'm Bob Miller, and I am chairing tonight because Supervisor Meyer, our regular chair, is not available. So the only comments I have is that we will have Youth Representative Shagula Millie read the statement and press the right button.
Okay. Hello, we are members of the Racine County Youth and Governance Program, and we will be participating in tonight's meeting. This program serves to empower youth in Racine County by encouraging us to participate in local government. We have agreed to abide by the applicable standards of conduct that would govern any elected county board member. While we are encouraged to participate and are allowed to have a non-binding advisory vote on matters before the committee, all formal action taken by this committee will be based solely on the binding votes made by county board supervisors.
Thank you very much. Well done. Item 3 on our agenda is public comments, an opportunity for the public to address the committee on any topic. Are there any members of the public who wish to speak to the committee? Hearing none, seeing none, we will move on to item 4, which is the approval of the minutes from May 26th.
Second.
We have a motion from Supervisor Wish and a second from Supervisor Trottier to approve the minutes. Any discussion, questions, clarifications? Hearing none. Youth and Governance, all in favor?
Aye.
Did that very well together. Committee, all in favor? Aye. Any opposed? Those are approved. Item 5 is an item from the Sheriff's Office authorizing a temporary agreement with the Village of Yorkville for police services for a revenue total of $4,716. And the action requested is first reading next week at the county board. Good evening, Captain.
Good evening.
Because we're broadcasting, can you bring that real close? And I don't know if it's on or not.
I'm Kelly Getzky. I'm the Sports Services Captain at the Sheriff's Office. I'm here to discuss entering into a contract with Village of Yorkville for police services. They're requesting entering into a contract what we would provide, the Sheriff's Office would provide 8 hours of service dedicated solely to the Village of Yorkville, 8 hours per month, which would generate approximately $4,700 for us by the end of the year. If this contract works out well, they have expressed interest in wanting to continue this contract rather than just the 6-month period, July through December. It's turning it into a 1-year contract at 8 hours a month. So a contract like this is similar to the other contracts we have with some of the smaller municipalities such as Dover, Elmwood Park. It costs the Sheriff's Office no money. We need to purchase no additional equipment and no additional manpower is required.
Thank you. Questions from the committee? Supervisor Trottier.
Thank you, Supervisor Miller. I'm going to comment that I would like a motion to move this for first reading on June 9th, 2026 at the county board.
Is there a second?
I'll second, but I got a question.
Yes, okay, Supervisor Wish seconds, and he has a question.
What kind of services do they get for 8 hours a month?
We just enforce their local ordinances, so any citations that are written directly to the Village of Yorkville rather than county tickets.
So you're patrolling them just,
We enforce their ordinance. So when we give them dedicated hours of service, they are dedicated to enforcing the Village of Yorkville ordinances.
so you're patrolling Yorkville,
Correct.
but only 8 hours a month,
Correct.
okay? I don't know. I just, doesn't seem like much. So, and that's what Dover does too?
That's what Dover and Village of Elmwood Park both have contracts very similar.
Okay. Who keeps time, their time? Are they keeping the time of the officers or are we keeping?
Nope, we do. So we'll provide them with a monthly report on hours, as well as citations written, all that. They'll get, all the numbers from us. Our patrol admin lieutenant, tallies all that.
Okay, thank you.
Supervisor Rossi.
Thank you, Chairman. This is something I wanted to comment on more so just on approach. I was doing some review of other contracts throughout. A lot of them were for, we had some Brown County, Waukesha County, Kenosha County. And, what I was really trying to establish is, what was the per officer cost? And although this particular item, I don't see anything wrong with it in the short term. I'm becoming more concerned about our approach towards cost recovery in these contracts. And I just want to have a word of warning on this one. I'm inclined to move this forward because I just don't want this to be a short-term issue. If they're looking for this, this 8 hours a week, that's something I'm willing.
It's 8 hours a month.
8 hours a month, excuse me. But long-term, I'm really starting to see a gap in our approach, and I'd like to understand why. And, one of the things I looked at is out of, the Brown County, Waukesha County, there's 3 contracts that I looked at there, Lisbon, Vernon, and Delafield. And the amount of categories for cost recovery is just significantly different. And what that really turns into, and I'll close and make my final point soon, is that when it's applied to a per deputy annual cost, out of the 15 contracts that I looked at, and some of them, of course, don't really apply to this because they're larger cities and, the municipal comparison doesn't really exist. But it puts us at about $135,000 per officer, when some of these others are 144,000, 225,000, 176,000. We have 2 categories for cost recovery. Some of these go up to 8, 9, even 10. And I really think we should start looking at total cost recovery as opposed to hoping we catch everything with an administrative fee and then completely ignoring overtime. That's my point. Thank you.
Thank you, Supervisor. Other questions, comments? Supervisor Wish.
Yeah, thanks. In one of the county board meetings, I think in the finance committee, we were talking about contracts and going back to Supervisor Rossi's kind of point. Obviously, these are all coming due at different times and different dates. So how are we going to get everybody? I mean, you're using the same parameters for everything right now, but costs keep rising. So when are we going to make an adjustment?
The cost of these contracts are reevaluated every year.
But you got to do them all at once, is my understanding.
We do. The reason that we didn't enter into this one any sooner, they've been asking for this since the fall of 25, was we revamped how our language is in our contracts with Corp Counsel so that all the contracts are worded accordingly.
So are we going to start charging more for the services of the sheriff's department to all these other communities?
We weren't previously charging an administrative fee. We're trying to incorporate all the costs that Supervisor Rossi's talking about. We're trying to incorporate it so there is no loss.
As they come due.
Correct.
Thank you.
If I could add on to that, the
Yeah.
costs that are on Appendix B are the actual costs. They are set in the deputy contract. They are all of our fringe benefit rates that all the employees are charged to. The hard thing is when we are negotiating with the municipalities in the summer or in the fall for the next year, we don't always know the WRS rate for retirement. And so we're putting an estimate in there. But once we sign the contract and we get into January or the first part of that contract, we are charging them the actual amount. It's just during the negotiation and signing of the contract that we don't always have those fringe rates, but they are the full rates that are charged for all employees.
Supervisor Trotter.
Thank you, Mr. Chairman. Thank you, Gwen, for explaining that. I just have a question. I'm curious then, after Gwen explained that, what do we mean by total cost recovery? I need some ideas. is missing here. Yeah, that's exactly correct. May I? Sure. Supervisor Rossi? Yeah.
Thank you, Chairman. Thank you, Supervisor Trotter. What it really comes down to is some of these, they have the absolute base rate, and then every, every single item that goes into the policing, which is, some of the categories here. There's personnel, operating supplies, mileage, we have mileage, vehicle amortization, equipment, supervision, investigative time, dispatch, facility usage charge, countywide indirect, equipment pool allocation, liability reserve, overtime billing being a major one that we are not recovering at all right now, which is, to me, is absurd, just to be very honest. And then body cameras, training. Right now we have, like in the Sturtevant one, there's one for training, or maybe that was part of the temporary contract. But those are all items that in a lot of these other contracts, there's a placeholder for, and I wish I could show you my
No,
chart
no,
here, but
that's fine. That's what I was looking for.
we don't even have categories for 1, 2, 3, 4, 5, 6. In every other contract I evaluated, they at least have partial recovery. And then on the larger contracts, they have total recovery, or at least as best as they can, frame it. So we're looking at right now is an administrative fee to cover what we're thinking of as unknowns, which are those categories, when instead we could define them and then bill them in that type of model. The issue is that, when it comes down to it, policing is more expensive than what we're thinking based off of comparable contracts. And comparable, there's nothing that is exactly Racine County, but that's the best I have right now is, like Waukesha, Brown County, and contracts that they have with villages. So.
Thank you.
Yeah, I think that's pertinent information, and perhaps I'll speak with Chairman Meyer, but perhaps at a future meeting, we could talk with the county executive and the sheriff about this, because I know it's a concern of a number of supervisors that's come up somewhat vigorously in the last two that we've discussed. So more to be discussed.
Thank you, Chairman. Last one for me. This came up during the Sturtevant contract, and I was just thinking about it earlier today. As a matter of process, I believe it was that the contract for Sturtevant was presented, negotiated, then brought to the county board. My point was that, we should change to the 7.5% to try and cover more of these costs that I've just identified. Didn't have the exact language at the time that I spoke in the county boardroom. One of the arguments that was used against me was that we would be negotiating in bad faith against Sturtevant, but never having the opportunity to see the contract in the boardroom prior to that point. Well, then moving forward, that same argument would hold. Question then, and this may be one more so for Gwen, I think you might be the most apt to answer it. Sorry to put it on you. I don't see any corporation council members here, but why don't we bring the contracts to the board and get approval prior? And then if there's negotiations afterwards, being that there is an issue with, if we can't see the contract or we don't see the contract before it comes to the boardroom, well, then if any changes are going to be argued as bad faith, maybe we need to bring that to the board prior to it being authorized or it being signed off on by the municipality.
Yeah, that's a great question. I don't know the answer to that. I know it's just been past practice. I mean, I can only speak on really like the procurement end of stuff where we're doing the procurement steps, we're doing the negotiating, and then we're bringing it to the board because we're trying to ensure we're getting the best price. It's a little bit different. Obviously, it's a revenue generating contract. I would defer to the county executive and the elected county sheriff because they're the offices that are over this.
County executive would like to speak, and we'll have him use the mic since we're broadcasting.
What I want to say here is that this has been a point of contention, obviously. And this contract is what period of time that you're talking about? So basically the rest of this year. So all the municipalities will be on the same timeline. Going forward, I would advocate for a multi-year contract, which we would do this fall already. Okay, so they're on the same timeline. And I want to revamp the whole process as far as streamlining it to give our municipalities a little more confidence in our behavior with contracts and how we execute them. And I do agree with you that it should be analyzed for the cost. Are we at the right cost? That being said, legally, obviously, we can't do a markup on services like law enforcement. It has to be the cost is the cost, right? So we are looking at that internally right now to see how can we revamp this process, get to a multi-year contract that for planning purposes for them and for us. And again, make it equitable across the board. Not looking to give anybody a deal and not looking to make a profit at the same time. So that is something that we are talking about right now. And for this budget process in this fall, when we start new contracts going forward, because again, these are, what we're talking about here is basically a 6-month contract. So we have to come up with a new process between now and fall. So that's where I sit on it.
Appreciate hearing that. And, certainly Supervisor Rossi alerting us to how other counties do it will be, I believe, useful information.
And as the county executive said, this is a process that we're going to reevaluate, but
Mhm.
we have to maintain consistency with all of our
Oh,
contracts.
yeah,
So
for
we
this
can't-
one, yeah.
Can't charge something higher
Right.
for this contract than we have for other contracts that we already have signed for 2026.
Totally understand and totally agree. Supervisor Shakur.
Thank you, Mr. Chairman. I'm not disagreeing with anything that has been said here, but what I want to make sure that the legislative branch, the county supervisors know that I don't want to get into the micromanaging. I think the administration has that charge. And I think we should be careful to not blur the lines. So I wouldn't want to micromanage the administration nor the county executive branch, but just, yeah, we do have to hold them accountable and it has to be consistent, but just, we need to be careful with that. That's all.
Thank you. Any other comments, questions? All right, we have a motion to send this to the county board for first reading. Youth and governance, all in favor?
Aye.
County supervisors, all in favor?
Aye.
Any opposed? That is approved. Thank you, Captain, coming in. Item 6 is Human Services, OPATO, ordinance by the Finance and Human Resources Committee amending the Racine County Code of Ordinances, Chapter 2, Article 5, Division 2 Departments, Section 2-276. Action requested first reading June 9th. Welcome, Director Otto.
Thank you, Mr. Chairman. What you have in front of you is both an ordinance and a resolution that is formalizing the MOU that was previously submitted to the board. A couple months ago, we had the MOU that was an intent to enter into this agreement so that both my committee and the board had sufficient time to be able to review what the scope of work within the collaborative applicant role and taking on this responsibility would be. This is formalizing it both through the ordinance and the resolution, adding in the dollar amount of $200,000, which is exceeding the amount of the allocation. But since the money that is coming into the continuum of care comes in a federal fiscal year, we're putting it in as a sum that would bridge both the allocation and any continuing funds from the previous period. Also, it states in the ordinance that this will be a position that is folded into the Human Services Department rather than in a department of its own. But it also has a county executive appointment and confirming, similar to our CVSO role, our county service veteran officer, which again reports to Human Services but is confirmed by the county executive. I think we probably have another position as the medical examiner. Emergency management has a similar function like that. I don't have any of the more comments related to this other than in the resolution. It also highlighted something that was a discussion point at my committee, which was the county executive's ability to appoint to the COC board. And it reads in the final bullet point that it would include the liaison, which would be the employee that would be facilitating the application and the overall functions of the collaborative applicant, as well as 2 individuals. And it reads as if another position would become vacant, that they would also be able to appoint that third. I have both Michael Thomas from HUD, or I shouldn't say HUD, ICF, which is a consultant for HUD. So they're our technical assistance arm that is on the line, as well as Robert Held, who is the board chair for the COC, if there's any questions related to their end of things.
So we have on the agenda two partner items
Mhm.
related to this. Would you think it appropriate to bring up the second one now, or do you want to wait?
I was going to suggest that if you were okay with that, absolutely.
I think it would make sense since they're definitely connected.
Yep. So as I mentioned, the ordinance is in the one that I've been reading. I think I accidentally just did that. And then subsequently, the resolution entering into the position not to exceed the $200,000 amount, which would not be what the position entails. Just to elaborate on the coverage of this, the position is estimated from our HR like full benefit package to be roughly $100,000, and the actual allocation is around 124, I believe. So the additional amount would be able to use for administrative expenses and oversight of the position in the department. So it's completely funded. And then also to support some of the work that the finance team and supervisor of the department would do.
We have two individuals in the room who, in addition to Helena and Hope, have been vitally involved in this. I'm thinking of Supervisor Rossi and the county executive. Do either of you want to make a comment about how you see this enhancing services?
I see it as an ability to corral services and resources and come at it from a more coordinated standpoint overall for our homelessness efforts and homeless issues in Racine County. That's how I see it. At essentially no cost to the county because of the HUD funding through the COC. But again, with our connections, our expertise in those areas, it allows us to take a more, what I want to say,
Holistic?
strategic
Yeah.
approach to homelessness issues in Racine
Yeah.
County.
Yeah. And that very point came up at our Health and Human Development Committee meeting. So many of our staff members and our divisions have connection to this issue that it only makes sense that we would be more involved, I think. But I'll let Supervisor Rossi comment as well.
Thank you, Chairman. And thank you for getting the additional position on the board. One of the items that came up in the committee was we were looking to see one additional person make it to the the nomenclature at this point that escapes me. Was it the coalition board or continuum? board?
Continuum of care.
Continuum.
Like now I
Thank
don't
you.
know.
We were just hoping to see more influence from the county board, and I understand that, at the same time, maybe that's not, we don't want to see the county board or county influence take over the direction of that same board and body. But we did like at least one more. I'm very happy with that. Thank you. And I would like to say I did talk to two individuals who are very close to this process. And I said, give me your honest opinion that there's no downside that anyone's perceiving from this. They said this is a great thing. I wish I could say their names, but I didn't get their okay from it, but just very positive things. They like the idea of the stability that's going to come from the county. They like the idea of the staffing, the support that's going to come from the county. We're allocating one position to this, but it goes without saying there's a lot more horsepower that comes with it. So all great things.
Thank you. Other comments, questions? All right. So let's go first to the item 6. I don't think we have a motion yet, do we, Nicole? No.
I'll make a motion, excuse me, Mr. Chairman.
Yeah, go ahead.
Thank you.
Supervisor Pioneer.
I'll make a motion to approve this for first reading on June 9th, 2026 at the county board meeting.
Second.
We have a motion and a second to send this to the county board for first reading June 9th. Any further discussion? Seeing and hearing none. Youth and governance, all in favor?
Aye.
County supervisors, all in favor?
Aye.
Any opposed? That is approved. And since we've took them together, let's jump ahead to 7B for the committee's desire on that one.
Motion to approve first reading, Mr. Chairman, at the county board on June 9th, 2026.
We have a motion and a second to send this to the county board for first reading on June 9th. Any further questions or discussion? Hearing none. Youth and governance, all in favor?
Aye.
County supervisors, all in favor?
Aye.
Any opposed? That is approved. Thanks to all. Okay, we still have another human services items, namely 7A. Hope and Yelena are here to authorize the creation of one FTE crisis supervisor, rank BE 45, effective June 26th, and transfer $60,154 in funds within the Human Services Department 2026 budget. And again, this is requested for first reading next week.
Okay, I'll start off by giving an overview of the Stabilization Assessment Information Linkage, aka SAIL program, and sort of the rationale behind why we wanted to add this position in now. And then I will turn it over to Yelena to give a background on the billing aspect of it, because it's a little complicated. When it comes to Medicaid billing with DHS, nothing is simple. So the explanation behind it isn't either, but I'll try my best to explain, what has changed in the rules and why we're doing this now. So our SAIL program serves as a crisis stabilization. We call it a hostel, but for lack of better words, it's a diversion out of inpatient hospital setting, and individuals are able to be connected to the clinic, case managers and individuals to bring them out of their state of crisis. That could typically be done in a hospital setting at a much higher cost, and also more disruptive to their families and out of their communities. We've been doing this program since 2012, and I've explained to the board and committee, I believe, on several occasions, the cost benefit of this, as well as the support we have from NAMI and the advocacy community on our model. So we have been investing in this, but also one of our challenges is in our current location, our capacity is limited, and we've been operating in a quite lean fashion because of the way our reimbursement for the program works. That is going to be changing in 2027. So currently we bill crisis, which we receive about 40% reimbursement for every dollar we bill. Moving forward, we are able to bill on a per diem basis. This is a change that has been made from the legislature down to DHS to us that allows us to now fully recoup for these type of services. So the request that we have here is for this year's expense, because that provision hasn't changed. And we will be able to fully bill and recoup for the services in 2027, but we would like to do so now, knowing that we're opening the facility. We want to be able to have appropriate staffing moving forward. We have 18 employees in our SAIL crisis hostel for a 24/7 operation. I think that's arguably a pretty small number, and we have one supervisor for 18 employees. Most ratios are much closer to 1:7 or 1:9 for that type of work, and it's again 24/7 on evenings and weekends. So is there anything I missed, or is there anything you want to add regarding the billing or specificities with that?
So I guess I just want to bring some light as far as how we're currently billing. Right now, when you think of a sale technician, they're billing at 47.42. So the addendum that was provided, the 35.36, Medicaid also likes to switch rates and not give us a heads up. So I snuck in there this morning just to make sure there wasn't any tweaks. So for a sale technician, 47.42 per hour. That means that you need to be face to face for crisis stabilization and document your interaction for a full hour to get that amount of reimbursement. For a bachelor's or master's level, we had it on the addendum as 66.29. Recent update, now it's 88.90 per hour. So just for simple math purposes, with the crisis stabilization billing change that's taken place, we are now able to switch from hourly billing to per diem. So instead of billing those hourly amounts and needing to sit face to face with somebody providing those services for that amount of hours, instead you're just able to say, hey, we're a crisis hostel, we're providing crisis stabilization services. We just bill a flat rate of $520 per day if they are here. So that, as you can imagine, encompasses a little bit of changes of our documentation behind the scenes, based on our daily average population of what we're seeing at sale and our projections for the changes with this. We're estimating this will be about $1.233 million of reimbursement versus where we're currently at. And we were averaging a little over $300,000 for reimbursement just because they're so strict on those parameters. Just to put it in perspective, because this is how my mind works, if we're trying to get $520 per person reimbursed per day, right now it would take us 11 hours of face-to-face time at a technician level, which just is not realistic to think someone's going to sit there for 11 hours of crisis stabilization.
Were you averaging like 2 to 3?
2 to 3.
Right, so it's.
So this will obviously, the project expenses of sale per year are estimated at $794,000. Obviously, if we're estimating 1.233 in revenue, it will offset adding a supervisor. I think when, to Director Otto's point, when we're talking about our level of stabilization services that we provide, the safety and security of the staff members there, the safety and security of the consumers that are there. There's a reasonable need for clinical supervision oversight during those second shift hours.
And one last point I would like to make about this is all really positive. The only thing we need to be conscientious of in the upcoming budget is the amount that we have been budgeting for. You probably remember me talking about WIMCR, and I can't remember what that stands for, but that's the reconciliation. Do you know what it stands for? Something. Okay. It's the part where we reconcile our expenses that are, we know that the expenses are going to be substantially more than the revenue we get. And they recognize that through a really convoluted reconciliation process that takes about 1.5 years. So we get a payment based on the amount we're short, and we don't really know how it's calculated, but we've hired a consultant to try to maximize that reconciliation process to get more back. That will go down because now they are matching the amount here. So there is a slight cost shift because there is a part where they try to make us closer to whole. So, but it's still significantly improving our bottom line.
I'm compelled to say, as I have in the past, and I'm going to keep repeating it, this is another example of this department, and it's certainly current staff, but there's a long history even before your leadership of being aware of the rules that give us funding, and when they change, we change. And I'll say it again, when people wonder why our levy expenses for human services is as it is because we do things in such a smart way, capturing pretty much every dollar we can find, and we're always looking for it. So just a lot of commendation to this latest move. Questions from the committee?
Thank you. Master's degree in what?
It's some form of social work. So normally they don't have to be fully licensed or in training license, but social work counseling is our normal go-to that we can bill for. Psychology is allowable as well.
And the salary was $89 an hour?
That's the reimbursement rate for Medicaid. Salary is nowhere near that. That's the reimbursement rate is the $88.90 per hour. Every other, so this is specifically for the crisis stabilization CPT code, as they call it. There are other codes for like linkage, resources being provided, and those bill in 15-minute increments. And I will add in there that the reimbursement is very similar to these dollar amounts, but it's in 15-minute increments. So as you can imagine, if I was to have a 15-minute session with somebody, I could pull pull in almost $400 versus in stabilization, you're only getting $88 for the entire hour.
This is like medical billing. So if you were to go to your doctor and the APNP is there as opposed to a doctor, they bill at a different rate versus the nurse. It's similar. It's set up as like a medical reimbursement.
So Medicaid is going to reimburse us for more than we're paying this person for.
Because more than just that service is being rendered, just like at a hospital setting. You're billing in all the other aspects to conduct that visit.
What are the other aspects?
I'm the clerk, the supervision of the other
Food and
individuals.
sale, rent.
Yeah, yeah,
Mhm.
the building.
So that's all built into the $89 an hour,
Correct.
88 point.
Yeah.
Thank you.
Supervisor Rossi.
Thank you, Chairman. I may have had a misunderstanding after the chairman's comments about finding cost efficiencies. Is something changing about the formula for cost recovery on this? Or is it the position that creates the cost recovery change?
Both. So the fact that we have a crisis hostel that no other one exists in the state is allowing us to do this. So that's the first thing, that we have the infrastructure in place to be able to bill at a per diem rate. CBRFs, I suppose, could, but they've been doing that model, and there's a lot more overhead in a CBRF, community-based residential facility that's heavily regulated. So the only crisis hostel in the state of Wisconsin is ours, and now we're able to do something to be able to fund it appropriately.
And the second part of
Sure.
this would be, I think it was 40+ positions that we've added over the last 2 years, and my mind is mush for the allocation of the years, but with the majority of those being for your department, and that's fine, we are where we are, but we did just approve a salary increase, or implemented a salary study that's gonna yield cost increases over the next budget that we really don't understand at this point. I was hoping that with the creation of this position, that there'd be the elimination of another position to balance this out at this time. And I know it's a drop of water in a very big bucket, but all the drops add up. And that's why at this time, I just can't support adding a position that's not fully funded like the other one you had for tonight. I'm fully on board with that. I hope everyone can understand. I'm being cautious.
Mhm.
Thank you.
Supervisor Trotter.
Thank you, Mr. Chairman. Yelena and Hope, thank you very much for the statistics that you provided. And whoever was lobbying for this in Madison, it's a great change in the system to benefit our social services that we show and expound on. I think the three most important things about creating this position are safety, oversight, and above and beyond anything, a liability. When I look at 18 employees and one supervisor for a 24/7 shift, there's a big liability there. And I think we're in a position with the county right now for the balance of this calendar year. Granted, it wasn't in the 2026 budget, but it's something that we need to provide from those 3 points, from safety, oversight, and liability. And I'm a firm believer in this program, and I'd like to make a motion to approve this for first reading, Mr. Chairman, for the June 9th, 2026 County Board meeting.
A motion and second to send this to county board for first reading. So the other thing I didn't mention is that this also emphasizes our thrust, our structure on prevention. This program is like a model nationally. And how long have we had it? Quite a
2012.
2012. 14 years. And it's unique, and it serves people who need the service. And I think the results are much better than treatment that we'd have to spend a lot more on. So
Thank you.
thanks for that as well. Supervisor Wish.
What are the ramifications if this isn't approved?
I mean, we've been operating this way. I think Supervisor Trottier said it best. We're recognizing that this is probably not the safest level of staffing. We have had some personnel-related issues that we think have been disproportionately put on one supervisor. It's a very difficult job working with high acuity or high needs individuals, and the support is not there. So, similar to anything, when you don't have the necessary infrastructure and support, you have more burnout, you have more turnover, and you have less ability to take individuals in and more likely to be placed in higher acuity settings or higher need settings.
So you're adding another supervisor, but you can't subtract from someone else on staff.
Well, there wouldn't be an inherent advantage of doing that in the behavioral health area for the reasons I identified. There's revenue source associated with most of the positions. And so it's not, you end up cutting substantially more than what you're adding in order to get what we want. And here, this is a time limited ask. It would be 6 months to be funded at 100%. And even the 60,000, I'm assuming it isn't applying any revenue to it. Is that correct? And there would be some. We're putting this for very conservatively because that's part of that cost reconciliation process that I talked about. And we are able to bill crisis if they have Medicaid services. So this is put I'll let.
My mistake, we are billing Medicaid revenue for 24,000 of the 60,000 and
Okay.
36,000 is coming. We're decreasing contracted services lines.
Oh, thank you. So it's actually a 36,000 versus the 60 then, correct?
Can I just add
Yeah,
it quickly as well? So I just want to highlight our supervisory team is all required to be fully licensed. They need some supervisory experience, clinical experience, and so forth. The diverse programs that we have and all the oversight, one requirement is stepping into the leadership team. You're required to be in an on-call rotation. That means every 7 to 8 weeks, you're required to be on call. You work your 8 to 5, 5 p.m. Your on-call phone goes on until 8 a.m. in the morning. So essentially you're working 7 days straight with no downtime, phone ringing at 2, 3 o'clock in the morning. So to answer your question, that's how we've been providing coverage. Staff call us when they need us. When something's escalating, I've had supervisors go above and beyond, leaving their home, leaving their children, going into sale and rectifying whatever the issue is. I will also add that our current sales supervisor, who has been in the position roughly about 4 years, she was a lead for about 5 years, a long history there. She currently flexes her schedule to provide accommodating hours for second shift and third shift coverage, which goes well above and beyond probably 50, 55 hours per week.
I understand for a need for another supervisor, if you're open 12 to 7, 24 hours a day, basically. I get that. I understand that. My question goes back to Supervisor Rossi. Is there no other position that can be, eliminated in order to offset the cost?
Well, I think we just heard, I always appreciate when you two raise class questions because I'm thinking of them too and often raise them. But it sounds like this is neutral because we're looking at more revenue and we're cutting out contracts.
Yeah, so of the
So that's
60,000 net cost that's being transferred in the fiscal amount, 24,000 of that is increasing revenue because we'll be able to bill for part of that position. And then the 36,000 net is coming out of contracted services. I cannot guarantee that that's cutting a contracted worker. Like, to your point, Supervisor Rossi, I think you're asking for staff FTE to be cut. I don't know that that's an FTE. But we have contracted services where we're dealing with, outside agencies like that, where we have contracts with them. So we're decreasing that revenue line.
Is the revenue an actual number or is that an estimate?
The revenue is a percentage of the total, which to
So-
Director Otto's point, it was about 40%.
And that's a conservative estimate. It can be higher. It's based on if the individuals that are presenting to our care have Medicaid or not. If they have Medicaid and we have billable hours, we can bill for it. And we have found pretty consistently over looking at many, many years, I mean, I'm going to say 5 to 10 years, 40% is a conservative estimate for crisis. So we apply that, it could be more, plus it then ends up going into the reconciliation process and we get it back more a year and a half later. So as I mentioned earlier, the fact that this is going to be reimbursed at 100% means we'll get less of that payment later. So we take that into account as we're doing the budget. So say we budgeted, I think I did $1 million in WIMCAR this year. I might choose to make it 800,000 or 850, looking at that, but the amount we're getting from it far exceeds the amount we have to lower in the
So
reconciliation.
your answer is it's an estimate. It could be higher, but it could also be lower, the revenue number.
I mean, I'd have to ask you, have we seen it substantially lower than 40%? I don't think I could answer that without looking. That would be unlikely. Because we have a very heavy Medicaid population and the amount of QC and auditing that we do on our end. We have a QC department that's looking at billing, running through our reports. We're ensuring that we are getting as much as we can of the revenue. Is it possible? Sure.
Thank you.
Can I just add the one concrete thing that I think we do have is the average daily population that we have at sale has not changed. So we looked 5 years back, we've been sitting around the same amount. And when I say same amount, 0.5 fluctuations up or down. And by the end of the year, we offset. So that helps us feel a little bit more confident in the statement that we're making.
And lastly, we do have vacancies. I mean, there are positions that we're unable to fill, but that in a lot of ways is lowering our revenue line as well. And so all those things get made up in the wash, in the process. So it's just I would not recommend cutting another department for her department outside of the budget cycle. If I'm looking at the budget in whole, we do that as a team, but my recommendations typically aren't going to be to the youth and family division and say, I need you to cut somebody because we're adding here, which is going to roughly be about 20 or 30,000, which is a fraction of a position. I wouldn't make that recommendation as a current need. I would look at that in the time that I had a more comprehensive evaluation and had adequate time for my team to be able to convey their needs and the consequences and liabilities and risks that exist for those eliminations.
Can I add one last thing? And I'm quiet, sorry. The only other thing that I would like to think about is the cost of Winnebago per day, 2,200. Lots of times sale is the only option, and community hospitals won't even take individuals. So we many times are taking individuals that are higher acuity at sale, but still within a safe parameter with the right clinical support there. Without that, unfortunately, we have to, if they're more symptomatic and, or beginning to escalate and we can't calm them down, they're going to Winnebago and it's costing us more.
200 a day.
I know. I think it's what, 2267 to be exact.
Because they add on the potential $400 cost as well for one-on-one care, and they determine that. Because once they leave our care, we don't make decisions anymore. We control the expenses when we operate the program. That's why we prefer to do that versus contracting out.
My quick phone calculation of that's 827,000 a year.
Correct.
One person sheriff. Did you add in the sheriff at Ives too?
No, right, that doesn't include the transport and.
No.
Mhm.
It's more for transportation. All right, thank you. Any other questions or comments? Supervisor Rossi.
Thank you, Chairman. Just following up on the discussion that was had about the cost allocations. And yeah, the only thing we have to go off of right now is what's in front of us, and the 40% allocation that's understood. I can see that, you are looking to recover that from Medicaid service revenues. But again, it's another situation where we're taking money from contracted services and putting on another full-time employee. Now, I will concede that the reconciliation statement for your department is excellent. Maybe there's something else that needs to be looked at here, because for the last 2 years, you've had a substantial favorable reconciliation. 3 years ago, not so much,
Mhm.
but that tracks just as well with how much your budget increase has been.
Mhm.
Maybe there's a tightening up there that happens that makes this all make more sense
Yes,
and doesn't make the budget increases look so bad.
correct. That's
I
100%.
think you guys are keeping a very big buffer right now to keep things safe over what the last two budget cycles have been. So maybe we see something different than in the 2027 process.
Mhm.
But my statement still stands and my
Yeah, it's fine.
conservatism on this. Thank you.
Yeah, thank you.
Thank you. Anyone else? All right, we have a motion to send this to county board for first reading. And because I think there may not be consensus, I'm going to call the roll. Youth and governance, all in favor?
Aye.
Okay, Supervisor Trotter,
Yes.
Supervisor Shakur,
Aye.
Supervisor Wish.
Aye.
Supervisor Rossi,
No.
and the chair votes yes. So that motion passes. Thanks to everyone for the debate and,
Thank
you know, really, really good discussion on the complexities of human services, costs and billing. Appreciate that.
Thank you. Thanks.
All right, we are, think up to item 8, which is Director Zimmer giving us the Racine County Sales and Use Tax Report update.
Thank you, Chairman. In accordance with the ordinance 7-233, this is the monthly report of the sales tax revenue received from the prior month. We are at 9.6 million. The first 2 months were booked back to the previous year because the bulk of those service dates were for 2025. The auditors are in favor of that policy just moving forward. So we'll always have 12 months, but it'll be March through February of every year. And I just wanted to note, as a reminder, that we budgeted 21 million in sales tax revenue in the 2026 budget, 15.3 million to operations, 5.7 million to debt service as a direct property tax relief, and we've fully met that obligation now. So everything else for the rest of the year is for operations, and I do anticipate that we will exceed the 21 million, probably to 23, 24 million. And then that's at the direction of this body on how those funds are used. But in 2025, we put that into reserves.
Thank you for that report. It's pretty good news in terms of revenue. Any comments? Youth and governance? No, okay. All right, we will go on to item 9, communication and report referrals from the county board meeting. Motion to receive and file is in order.
Second.
Well, I'm looking for a
I'm
motion.
sorry, I thought you.
Supervisor Trotter moves
I so moved.
and Supervisor Shakur will second?
Yes.
Okay, any discussion? Youth and governance, did we explain this to you? So, okay, so we get a lot of things and many of them are bankruptcies. And by ordinance, we get these things, but they also go to the corporation council and they're the people, the staff who know what to do with all these. So this is just kind of a ordinary motion that, yes, we know these exist, but we're accepting them, but the proper staff are already working on them. Okay, we have a motion to receive and file. Any discussion? Youth and governance, all in favor?
Aye.
County supervisors, all in favor? Any opposed? That passes. No action items. I would like to just comment, though, I thank Director Zimmer for sending out, I think it was today, an explanation of the year-end reconciliation process and some data from the last several years. So anytime we can become more educated on how the budget process works, we're grateful. So thank you. Any other announcements? Any comments from our distinguished youth and governance reps? Okay, it's not required. I just want you to feel free. Okay. Motion to adjourn is in order.
The move.